All right, thank you, Rodney. Time now 6:06. We are now ending the fourth week of social distancing due to coronavirus. And for many, not all of you, but for many of you, it's taking some kind of mental toll.
It certainly is, whether it's being cooped up over all this time at home, the fear of getting the virus, changes in sleeping or eating, and yes, in many cases, it's self-medicating is happening. But as our guest tells us this morning, there are some ways to cope in a healthy way. Joining us right now, you see her via Zoom, licensed professional counselor Brynnan Reddy. Brynnan, good morning.
Good morning. Thanks so much for having me.
Thanks for coming on this morning. We really need you. Really need you. What are some of the things, some of the behaviors that we should be recognizing, some of the changes before we can actually do something about it?
Sure. You know, one of the things that I'm noticing the most in my practice is there's definitely an increase in stress and anxiety during this time. I think sometimes when we have this kind of uncertain looming vision in front of us of not knowing when this will end, when things are going to get back to some semblance of normal, it can be very overwhelming. And I think the biggest thing that I'm recognizing in my clients is this level of grief that perhaps we're not necessarily recognizing as grief. Anytime we have a huge major life shift, there always comes some level of grief. And it's, you know, it's grieving what was, grieving this quick shift of changing into this new routine of, and now I can't really leave my house. So, you know, it's definitely overwhelming for a lot of people.
Okay, so say we've recognized these triggers, these behaviors. So what are some ways to reduce stress or anxiety now that we know kind of what's setting us off?
Yeah. So, you know, I would say that one of the biggest things that we can do to really implement self-care during this time is to have some sort of routine. Try to go to bed around the same time, wake up around the same time, change your clothes, change out of pajamas, set some parameters around your work from home schedule in terms of having, you know, a set start time, a set end time. And you can do that with your kids too, if they're doing e-learning right now, you know, so that they know when to expect to be on and be learning. Another thing that I think is a really important thing to do is limit your news consumption to local or regional news, because when we look at the world as a whole, that can get incredibly overwhelming. So set some time limits and have a certain time of day that you check in and check the news or check in with social media. And after that, just let it be and know that there will be news again the next day. You don't need to be connected to the news 24/7. And again, reiterating, local news is better because that's what's impacting you more directly. I would also recommend recognizing that social distance, that term social distance, doesn't mean we need to be totally isolated. I like to look at it as physically distant, socially connected. So making sure you're connecting with friends via FaceTime, via Zoom. In my neighborhood, one of my best friends lives across the street from me. We park our yard chairs at the end of our driveways, so there's a street between us, but we're still having that social connection. You know, trying to find those ways to do that, getting out of your house every day, getting some fresh air. And really knowing that if you feel like you need help and support beyond just your friends and family, there are options out there for telehealth. A lot of insurance companies are covering mental health services now, whereas they didn't before. Now, under the certain circumstances, they are allowing those coverages, and most therapists that I know in the area are in fact offering online services to offer additional support at this time.
Brynnan, some awesome advice there, and I'm sure that goes for all those essential workers out there who need also to find kind of a healthy calm as well. We really appreciate you joining us this morning. Thank you so much, Brynnan Reddy, who's a licensed professional counselor. Thanks, Brynnan.
Thanks for having me.
And we want to point out that there is help, as Brynnan mentioned, 24/7 on your screen right now, a number to the Disaster Distress Helpline. If you're just beyond the help, like she said, of needing family and friends, you can talk to a professional. 1-800-985-5990. You can also text the words "Talk with Us" to talk to a counselor. You just text "Talk with Us" to 66746. You are not alone with these feelings. This is new age. You are not alone. Help is available for you whenever you need it.